3 weeks after open heart surgery, St. Tammany Sheriff Jack Strain today said he has never felt better.
Sheriff Strain is back at work now on a limited basis. North Shore Bureau Chief Doug Mouton shows us what happened and what the sheriff hopes others learn from his experience.
Those flamingos are Jack Strain's way of saying thank you to the people at Lakeview Regional Medical Center. 3 weeks ago today, doctors performed open heart surgery on the sheriff.
It really is incredible to see how much better I feel today as opposed to prior to the surgery.
This morning, Sheriff Strain, his wife, and hospital staff told the story of what happened. He's been St. Tammany's sheriff for 15 years now, and around a year ago, he first noticed an irregular beat. It got worse about a month ago, so he asked his wife, a nurse, to listen.
Okay, so I felt that, and he got a good beat, and the next beat was a little weaker, the next beat was a little weaker, and then the next beat there was no beat.
I knew that it was more serious than anything whenever I started losing the ability to have long conversations.
Those warning signs prompted Sheriff Strain to see a cardiologist who pretty quickly diagnosed the problem as something the sheriff was born with.
When he was born, his aortic valve, which is the valve that separates the left ventricle from the aorta, he was born with 2 leaflets instead of 3. So that's his valve.
There is no medical treatment or medicine to fix the sheriff's problem. Doctors say open heart surgery was his only real option, so the sheriff got a new mechanical valve.
This valve opens and closes naturally with the heart's regular motion after it's implanted in the patients.
Doctors say by listening to the warning signs, Sheriff Strain dodged a bullet.
If this had gone untreated, probably his survival would have been 2 to 3 years.
And he hopes his story will encourage others to do the same.
Just because you take care of yourself, don't fall into the same category that I did and believe that you're invincible or that you're not vulnerable to these types of situations, because I was.
Doug Mouton, Channel 4 Eyewitness News.
Dr. Menon says the 3 most common symptoms of heart problems are chest discomfort, a change in the heart rhythm, and shortness of breath.
This is what's happening now on WDSU News at 4.
St. Tammany Sheriff Jack Strain is talking about his heart surgery for the first time since his procedure. WDSU North Shore reporter Heath Allen spoke to the sheriff and his doctor about the condition and recovery.
It has only been 3 weeks since St. Tammany Parish Sheriff Jack Strain underwent heart surgery right here at Lakeview Regional Medical Center. But today, he, his wife, and his doctors want to make sure you get a very important message.
When you got the diagnosis that, for a guy that runs all the time, that's in pretty good shape, you needed heart surgery.
I did. I required what we call open heart surgery, and again, in my age group, that is the big ticket. That's, it is a serious surgery. I required that surgery, and after consulting with my physicians, knew that I had no options and moved on with it.
You had to go to the doctor. Most people are afraid to go to the doctor. Is there a reason, Dr. Menon, for people to fear getting checked out?
Right. I think in men, it's mainly because it's a kind of a realization of one's own mortality, or that we're not going to be here forever. And, when you become symptomatic, it's scary, especially if you're an individual who's been healthy for most of their lives, runs like the sheriff does, doesn't expect to have to go through this. That feeling of invincibility probably doesn't leave. And, when we realize that, something may be wrong, I need to go get checked out, it is somewhat of a wake-up call.
But that trip to the doctor probably saved his life, didn't it?
That and having a wife like the one that he has.
I'm moving over here because of that. You're the one, Lisa, you said you have to go to the doctor. You have to pay attention to the symptoms.
Yes, he ignored them, tried to ignore them, and I said no. I said I'm just going to make an appointment, and made an appointment, and there we went. I said, meet me here at work, pick me up, we're going right across the street.
Were you afraid? Were you scared?
No, I wasn't. I was stunned at the diagnosis, but I just figured maybe he should have some irregularities in his heartbeat, and he'll end up having to be on some cardiac medicines. That's what I've just projected. Lo and behold, that would be in open heart surgery a week later.
And what happened was, Dr. DeCourty, you have the valve in your hand. This is what y'all put in the sheriff's chest.
Yes, it is. It's a mechanical heart valve. It's one of the types of replacement valves that we use to treat condition of aortic valve stenosis, or narrowing of the valve, or leaky valves as well.
And prognosis, I mean, this will be there,
This will be there the rest of his life, and he should live a long, normal life after this.
So the message is simple. If you have any doubt in your mind whatsoever about what may be in your heart, make that doctor's appointment. On your side here on the North Shore, Heath Allen, WDSU News.
Live in HD from WVUE TV New Orleans, this is Fox 8 News at 9.
A familiar face on the North Shore hopes to raise public awareness of the need to be heart healthy. Sheriff Jack Strain spoke publicly today for the first time since undergoing heart surgery. He says last carnival season he began to feel like his heart was skipping a beat. As time went on, he says he experienced more symptoms like losing his breath. That's when his wife pressed him to see a doctor. Strain now wants to encourage others not to wait and go see a doctor immediately.
Too often, people ignore the symptoms and the signs of pending doom, and many times suffer the ramifications of ignoring their health care, sometimes to the point of death.
The doctors say Sheriff Strain's recovery from heart valve replacement surgery has gone exceptionally well.
3 weeks after undergoing open heart surgery, St. Tammany Parish Sheriff Jack Strain is urging people to stay on top of their health. WGNO News reporter Vanessa Bolano has more.
In recent years, St. Tammany Parish Sheriff Jack Strain lost weight, became a runner, and watched what he ate. The last thing he expected to hear was that he needed open heart surgery.
Whenever he told me that my illness required open heart surgery, he could have simply put his finger on my forehead and I would have fallen.
The sheriff had an abnormal valve from birth. He never knew it, but this year he felt winded. And his wife, a nurse, knew something was wrong when his heart skipped a beat.
4 weeks ago, he come in there and he said, I need you to feel this. And I said, okay. So I felt that, and, you know, he got a good beat, and the next beat was a little weaker, the next beat was a little weaker, and then the next beat, there was no beat.
Heart disease is the #1 killer in the United States, and the sheriff is no exception. Without surgery, his doctors gave him 2 to 3 years to live. With surgery, he's extended his life, and now he's using this experience to inspire others to stop waiting and get checked.
I now know that God was not ready for me, that there is more for me to do. There's another chapter.
In Covington, Vanessa Bolano, WGNO News.
The sheriff says he's anxious to get back to work. His doctors say that should happen in a few weeks.